WREG investigator April Thompson looks at the illnesses affecting so many in the Mid-South, the toll they are taking, and the fight to turn the tide.
Talk to anyone who spent a good deal of time in Memphis, and you will likely hear our city has plenty to offer. From entertainment to the history to the food. But underneath, there is also something else, a health crisis. The Shelby County Health Department found heart disease, cancer, and stroke as the top reasons for death in Shelby County. Findings echoed by Methodist Le Bonheur Hospital and Chief Academic Officer Dr. Robin Wamadou.
When you look at heart disease and stroke, certainly they have similar comorbidities, diabetes, hypertension, hyperlipidemia, high cholesterol.
She says the conditions are interconnected and in many cases are impacted by life choices and where you live.
If you look at data from our own health department, you can see that there are zip codes in our community that are certainly at higher risk for these conditions. In fact, you can go from certain communities, you can go 10 miles in this community from certain zip codes to another zip code and gain 10 years of life.
According to the health department data, zip codes in Fraser and Bartlett have fewer grocery options and face higher food insecurities, 87.1 and 99.2 on a national scale of 100, compared to areas like Arlington and Germantown that have a lower food insecurity rate of 23.1 and 5.8. But it's not just geography impacting health. Race also plays a big part. A higher rate of African American women in Shelby County are getting breast cancer and dying from it compared to Caucasian women. West Cancer Center and Research Institute and the University of Tennessee Health Science Center are trying to figure out why.
Part of it might be education. Some patients feel something in their breast and do not at least have the wherewithal to say, oh, this may be cancer, let me go to my physician early, instead wait until it's too late to get in. And so if it's education, then we will enact sort of education measures in the community that would hopefully close that gap.
But doctors say to turn around any stats, it will take a willingness on the part of the individual to make a change. So 2 years ago, as a result of their needs assessment, Methodist started a Healthier 901 initiative, putting the focus on doing something that can directly impact the deadly health conditions affecting people in Shelby County: losing weight.
That's what leads to you having the stroke, the heart attack, and at risk for cancer. Those metabolic changes that you have from obesity.
They set a goal: lose 1 million pounds over 3 years. And the movement is catching on.
One other way.
Pentecostal Temple Church of God in Christ has members picking up the challenge and exercising together.
I tell them all the time, you don't have to run a marathon, but just move. Again, just get this movements of your body that you don't typically do.
And many are seeing life-changing benefits.
There you go, come on.
71-year-old Deborah Davis says it's been a big motivator in her losing 132 pounds and being able to reduce her type 2 diabetes medication.
But I was on insulin 4 times a day with an A1C of 17, blood sugar reading 382. Now I'm insulin free.
Pentecostal Temple's Bishop Charles Patterson says bringing this challenge to his congregation was a no-brainer.
I believe that the church put forth an effort to push health initiatives in our communities. I believe that a healthy community is vital to the success of the overall success of our community.
Individuals are also using Healthier 901 as a way to stay motivated. Jimmy Scott spends plenty of time at the Y in Cordova. After a health scare, he upped his walking and jogging.
2022, I had a scare with my knee, and the root cause was too much weight.
He says Healthier 901 was the push to get him back on track.
Since I started in September, roughly 18 pounds. from September to June of now. So it's been a big win.
Doctors say it doesn't take much to make a life-saving change.
None of what we're talking about is very easy, or we would have done it already, right? Increasing your activity, changing your diet. Those things are difficult to do, but doable.
And turn around the stats on the heart disease, cancer, and stroke that are killing us.
I think we have to embrace the fact that these conditions are preventable. And then what do you do as an individual and collectively to prevent them?
From your news leader in Memphis, April Thompson, WREG Investigators.
Trying to make a difference in our health. And for a look at all of our reports on what's killing us, go to the Investigators section of WREG.com. You know, Tyler, I like that piece of advice. The one lady said, just start moving.
Just do. You don't move it, you lose it, right?
Right,
It just
right.
doesn't take